Hi, I'm Dr. Kara, and in this video, we're going to talk about sciatica. I get asked about this one a lot. So have you ever had or are you currently having any sensations like shooting, burning, or tingling that travel down the leg or go into your groin area? What is sciatica? Sciatica refers to pain that radiates along the sciatic nerve pathway, which branches off from the spine in the lower back and goes through your hips and your buttocks and down the leg. You might feel different sensations down the back of the leg, the front of the thigh, into the groin, can be into the toes, different points along that nerve path. You might have pain with coughing or sneezing, and your symptoms might be pretty severe. Typically, pain is felt on one side of the body. Why does it occur? Most commonly, it occurs when a herniated disc, a bone spur from the spine, or narrowing of the spine compresses part of the nerve. The inflammation causes pain that can radiate down the pathway of the nerve. In rare cases, it can be caused by tumor or disease. Or the sensations might not be coming from your back at all. There might be a tight muscle in your buttock called the piriformis that's pressing on the nerve in that area. A consultation with a provider, or yours truly, can better help you understand where the pain is coming from and the seriousness of your situation. Most cases resolve with conservative treatment in just a few weeks. Significant leg weakness, change in bowel and bladder function, or foot drop are considered more severe signs and may require surgery. If you have been working with someone or your symptoms are progressing, then it's an indication for imaging. If your symptoms are improving, meaning the symptoms that you're having down in the leg are leaving and moving up towards the spine, then that's an indication that you're getting better. So now let's talk about some exercises you can try to help relieve your symptoms on your own. So first, we want to get stability around the spine. So the first thing I want to teach you how to do is work on diaphragmatic breathing to engage that diaphragm muscle that directly supports that spine from the deepest layer inside our bodies. So you're going to lie down on your back with your knees bent, and I want you to bring your hands to your lower rib cage, and we're going to do what's called crocodile breathing. So what you're going to do is you're going to inhale through your nose for a slow 3 seconds, trying to bring that air down and fill that lower rib cage. So your lower rib cage is going to move down and out. And then you're going to pause for a couple seconds, and then you're going to exhale through your mouth or your nose. And when you exhale, you want to think about drawing that pelvic floor up and in and tightening that pelvic floor slightly, okay? So here we go. Let's practice some crocodile breathing. You're going to inhale through your nose for 1, 2, 3, and then pause, and then exhale slowly through your mouth for 1, 2, 3, 4, 5, or 6. Okay, and you want to practice the diaphragmatic breathing. Is going to help you engage that muscle, which can take pressure off that lumbar spine and around if you've got inflammation at the spinal level that is creating these symptoms down the leg. So you want to practice this breathing about 5 to 10 minutes every day. And then next, we're going to work on some supine marching. So again, you want to think about breathing in and moving that rib cage down, and then exhaling, bringing that pelvic slightly up and tightened to have a nice stable spine. And we're going to add here just lifting the right knee and the left knee. And so this exercise is called supine marching. We're trying to get stability around the spine. And a lot of people are like, oh, marching is easy. You just lift your knees. But if you're lifting your knees and your back is moving, then you're not controlling it. And that's going to put more pressure in that area and can continue creating symptoms. So what I want you again to do is to really focus on when you inhale, moving that rib cage, pushing down, and then exhaling, the pelvic floor tightens. You get a nice stable pelvis, and then you're just going to alternate lifting the right knee and the left knee, and go ahead and do about 10 to 20 reps here, keeping that pelvis nice and controlled. And you're not sucking it in tight and tilting the pelvis or anything. You are just trying to keep slight tension in that pelvis while you're still breathing, or slight tightening of that pelvic floor while you're alternating. Now, the next set of exercises we're going to move into are going to be some sciatic nerve glides. So here is the level step 1 in working on the nerve. So what you're going to do is you're going to bring that right leg up. You're going to hold behind the knee here. And with your foot relaxed, we're just going to bend that knee and extend the leg. So we're just going down and up with a relaxed foot, and I want you to do about 10 of these here, just going down and up. And start on the side that you're not having symptoms. So if you're having symptoms going down the left leg, let's do the right leg first. Just up and down with that relaxed foot. And then depending on how severe your symptoms are, you could try the second level here would be extending with a flexed foot. So if that feels okay for you, then you can flex the knee and extend that leg up with a flexed foot. Toes are coming towards you as you are extending. So that's a level 2. I hope you found this video helpful. If you would like to gain more mobility and strength to feel better in your body, I offer a free club membership where you can enroll to receive my weekly excerpts and more. Just click on the link in the description, and if you have any questions, feel free to reach out to me via text, email, or Instagram. Thanks for watching, and let's keep getting stronger and more mobile to live longer.